Hey y'all. All right, so I wanted to come and talk to y'all about what to do after you have been unsuccessful on boards. Of course, none of us want that to be our story, but the truth is, many of us, that is our story. That was my initial story. I was not successful on my first attempt. Had nothing to do with my knowledge, had nothing to do with my capabilities. I simply was not successful in my first attempt. I was a 4.0 student. I missed it by 5 points. But if you do not know how to approach the test, and if you do not know how to apply the knowledge, then you're going to run into these things. I get it. And I talk to reviewers all the time because many people reach out to me, and a lot of people feel like it's not many of us that have encountered the situation, which is not true. It's many people who have failed, it's many people who have been unsuccessful multiple times and then come back and pass, right? But there's strategies to it. And when you see the shift, you realize that it really wasn't as drastic of a change that you needed to make as you're anticipating in most cases. It's simply understanding what needs to be done. Now, first off, grieve the process. I call it grieving because it really is. We have put in a lot of work. You go through 2 year program to get to this level, right? And you've been a nurse, you have done the work, but let's just be honest, there's so much being thrown at you during that 2 year period. And as you're preparing and you're completing the steps and you're doing your preceptorships and your clinicals, and learning to apply it and seeing all the things and tying it all together, there's also a shift that you have to have. Number one, when you have been a nurse for some time, all of us have nursed in different capacities, right? And with that, you have to shift your thinking. I always give the example of myself in this because we don't take into account how huge our past contributes to how we test. But when we're processing through things, and think about it, when you struggle with something or if you're trying to recall something, you're going to think of things from your experience. So for me, I've always worked in acute care. I've always worked in a hospital doing cardiology. If y'all know me for some time, y'all know that's my background, right? But my nurse practitioner's specialty is family, right? So that was a complete difference. So although I know what I have gone to school for, when you test, you think of how you process through things in the hospital. So for example, there would be certain things that the answer would be to refer. And I'm not thinking to refer because to me, I'm thinking of what I would normally do in the hospital setting to manage this, right? And so it's correct, but in your scope as the family nurse practitioner, that's not what you're doing. You're referring out to that acute or higher level of care to manage that thing. So there's certain tiers and levels of how we need to shift our thinking. I think a lot of times that when we get that unsuccessful score, we start to beat ourselves up. First off, you need to understand what the scores mean because it can seem very vague because it says high, medium, low. Trust me, I know because I had the report, right? High, medium, low, and just random generic areas, assessment, diagnosis. It's real grouped together. So you're sitting here thinking, all right, so what do I do with that? What does that mean? How do I go back and fix or strengthen those areas if I truly don't understand where I'm weak? That's why I tell y'all to study in the fashion of assessment, diagnosis, evaluation, and treatment, right? If you listen to any of my videos, taking any of my classes, have my review book, you know that's how I break things down. And it's for that reason, so you can begin to shift your mind to that. And when you realize it, that's what we do anyway. That's what we do in practice. That's what we do in nursing. That's what we do as nurse practitioners. That's what we do when we document our SOAP notes. That's what we're doing on this exam. That's what they're asking you about. But to see the full picture, we oftentimes, and what I commonly see with a lot of my review students, is that we group it all together. So pneumonia, diabetes, whatever, you can tell me that, yeah, I know with pneumonia that they may have a fever. We need to do a chest x-ray. We may treat with a macrolide or amoxicillin. You know that generically, right? You've studied it, you reviewed it, you've gone over it over and over and over again. You can recall that back to me and you feel like that's a strength. But you have the knowledge, but you don't know how to apply it. And you can't identify a weakness if you don't know how to approach it. So I'm big on knowing the approach. First, knowing that you are capable and not that, hey, I've been unsuccessful. Even if it's been more than one time, it does not mean that this is not for you. You have to shift your approach. And a common misconception, one, I noticed that reviewers just keep purchasing review. Y'all, the content isn't changing. My review, Leak's review, Fitzgerald's review, Barkley, Sarah Michelle, anybody else, whatever review that you're doing, we're not making medicine. You know what I mean? Like, we're not making up the content. We're all telling you the same thing. There's a different approach on maybe how we deliver it. So I always tell people, use what suits your learning style best. But once you have that knowledge, the application is the thing. The application and understanding your gap on how to take that knowledge and applying it to what the test is asking you is typically the issue. And so this is what I talk to students about, because even being a person who was unsuccessful, I had to figure out, hey, you know this stuff. You have a 4.0, you teach it, people come to you for the information. So what is the issue? I did all the reviews. I researched all the testing stuff. That's why I can tell y'all what to do. Honestly, when I'm telling you, go look at the blueprint. If you don't believe me, if you don't believe Leak, if you don't believe Sarah Michelle, or whoever else that has reviews out, if you don't believe us, go look for yourself. I always tell y'all, like, look, I'm not a girl that I'm just out here telling you what I think. I'm going to tell you what I know. If I'm coming out here to say it, it's because I want you to know what to do. Because if somebody gave me the blueprint, that probably wouldn't have been my story. But hey, I'm here to help you, right? So my thing is, first, if you have to see it for yourself, because we all receive and retain and understand things differently. So not just hearing me, Brittany, go through and say, hey, on the exam is this, and this. Some people, that works for them. Some people, they need to see it for themselves. Y'all, Google it. Go look up the exam blueprint. The ANCC as well as AAMP gives you an exam blueprint for each specialty. You can go in and see what's on there. Of course, they're not going to say, this is question number 1, right? But it's going to let you know that under assessment, this is what this looks like. This is the percentage of this in this area, etc. So go utilize that so that you can have a better understanding of what you're coming up against, right? Take the material for whatever review source you're using to keep studying and understanding the material, because I always stress, know the why, right? And you know these things, but you have to know how to apply it. So back to my example on pneumonia and why I say this. So again, when y'all study, typically on average, what I see commonly what I see is that reviewers will look at material, and you're studying, you're going through because there's so much, and you're just firing through. All right, pneumonia, they may present with rust color sputum, fever, it can be gradual, it could be sudden, we'll do a chest x-ray to confirm it, and then we'll treat with macrolides or amoxicillin, boom, then you move on to the next thing. Or hypertension is a scenario we commonly come in contact with, that I notice with students. And it's like, all right, I learned this in clinicals, or I did this, or whatever else. And it's like, yeah, but you don't understand what they're asking you. So if they're specifically saying to you that this is an older adult who was on an antibiotic 30 days ago, and they present with sudden rust color sputum, fever, etc. Yes, you're thinking in your head, I know it's pneumonia. I figure it's community acquired pneumonia. But then when you get to that treatment, you went with amoxicillin when you should have went with the respiratory fluoroquinolone, right? Like your fluoxetine, your levofloxacin. And why? Sorry, my earbud is falling. But why? Because think about it, y'all. This person was elderly who was on an antibiotic 30 days ago. So we don't want to just give them something on the lower scale, because there's a perspective of how we treat for monotherapy. There's a perspective when we utilize dual therapy, like you can use the macrolide plus the amoxicillin for your dual therapy, or you want to pull out, as we call it, the big guns, the respiratory fluoroquinolones to treat. So again, I say all of this and give this scenario because that's the application That is messed up. When I work with students, this is what I'm commonly having to say. And they're like, once I show them like, hey, well, this is why you missed this question, because look what you did here. And they're like, oh my goodness, that's what they were asking me? Yes. And so it's not so much of a knowledge deficit. It is studying all the way through so that you can apply effectively. So my big thing is, first, go ahead, grieve the unsuccessful attempt. Pull out that report and look at it. Pull up the blueprint so that you can understand what this really means. Okay? Understand where your deficits are. Review the material, but I don't need you to keep buying every review source out here. And now you're in a tizzy because you have 3 different sources out here. You're trying to figure out which one is more effective. And the true issue is, it's not that you don't know the knowledge or you don't have the resources of the knowledge. You're studying ineffectively. You need to have an effective strategy. Again, I tell y'all, assessment, diagnosis, evaluation, treatment. If you do those steps, you will be fine. Because it's going to slow you down and make you approach it just as you would in practice, just as you would document, and just how these questions may be given to you. And any fashion that they come to you with pneumonia, you'll be able to pivot and answer it because you know it not just as a blanket, but you truly know the information and can apply the information. So again, scenario. Let's stick with pneumonia. If you study pneumonia, all right, assessment. What is your assessment? It's those signs and symptoms. How do they present? What is that chief complaint? So, and what are you seeing, right? So I always say, think of the person walking into the office to you, or however you're delivering your services, right? So what are you seeing? What are they saying to you? So the patient came in, were they struggling? Did you hear labored breathing? Are they coughing while they're in here? Did they show you any sputum? Did they talk about like the color of the sputum? Did they mention this rust color? Did they have a fever? What do their vital signs show? Did you see a fever on exam? All the things. So assessment, knowing the presentation. So when you see that, you can start to categorize those things, right? Now you have a differential in mind. You're starting to think, I'm thinking community acquired pneumonia, but you need to confirm it, right? So that's where we go into diagnosis. When you are thinking about a diagnosis, you need to consider the differentials, and you need to consider how we confirm it. So what are those gold standard exams? I don't need you just telling me everything that we can do. You can know that, but what is the gold standard? What is the gold standard, right? Because that's what they want to know from you. So with pneumonia, we know gold standard, we're going to do a chest x-ray, right? It'll show white patchy infiltrates. So in some format, that's what they'll be telling you in the scenario to confirm that this is pneumonia, right? All right, so then you want to go and look at those different steps. Evaluation, as I tell people, is all the things that you're trying to evaluate and look at, all the things that you ask questions about and all the things that you consider, right? So what are you doing? Have they been on antibiotics in the past? Have they been treated with pneumonia in the past? Do they have a history of this? Are they allergic to anything? You're evaluating all the stuff so you know how to proceed with your planning, your treatment, right? Walk through the steps. You know what to do. It's not that you don't know what to do. I have so many people that say to me, like, maybe this isn't for me. And y'all know me. We're not doing that. You didn't come this far to only come this far. Yeah, it's for you. You just got to know how to approach it. You just have to know what to do with what you have, just like with anything else in life. And I'm always the person, tell me the game and I'll do it. I'll run the play, right? So all I'm saying to y'all is, don't allow the unsuccess to defeat you. Take a moment. You're human. Grieve it. But you got to pivot. And when you pivot and get back on it, I don't need you to go from a place of survival mode and start buying an influx of stuff and set yourself back even more, because now you're overwhelmed with too many resources and not the appropriate resources. Because it's not that you need more content, you need strategy so that you can study effectively. And you know your learning style, you know your deficits. What is the common thing that most people do? The area that we're weakest in, we try to review that last, right? Because who wants to do the stuff that's hard to them? I don't care if you're a child an adult, I don't care what it is in life, that's typically what we do. The hardest thing we typically try to push last or whatever. Y'all know, if you do any of my reviews, that's not what I'm telling you on. While you have the maximum time and momentum, hit that stuff that you're weak in. Give it your all. It doesn't feel good, but that's not what, this is only temporary. Do the hard now to get to what your goal is. It's temporary. We're gonna go through it temporary. We're gonna handle the weakness, and then when you're getting fatigued and your time is winding down with your studying, you're reviewing those things you were already strong in that doesn't require a lot of your time or energy. So go ahead and maximize your time, study effectively, and start with those weaknesses and work your way through. But don't just give up. Don't just sit here and spend idle time on things that is not the problem. Ask for help, y'all. If for the blueprint, the resources are out here, but you just got to do the strategy effectively, right? And don't think that you're alone in it. But if I had to give you some main takeaways, I would say give yourself grace, get back to it, pivot your approach, identify the weaknesses and see where you scored in, because when it tells you you were low in assessment, it's like, hey, it's letting you know that majority of the questions that you were getting incorrect was because you were not able to determine what they were telling you on those assessment findings, right? So although you know that community acquired pneumonia may have sudden gradual symptoms, you put something else in that scenario, or you didn't identify that that's what they were asking you, and that's where you're low in. So when you're studying, I want you to really focus in on that. And I also want you to pay close attention and do it through each one of those steps that I'm telling you, even if you have to slow yourself down and write it out. Again, pick your heart. I always tell y'all this. Look, my oldest daughter said it back to me the other day, because that's my thing. Pick your heart. I know it's hard to do all of these things. It's hard to continuously do this test over too, right? Pick your heart. It's temporary. And do what you got to do and be successful. Do the steps that I'm telling you and thank me later. I'm speaking from a space of experience, from me personally doing this, and this is what shifted my understanding. I'm knowing what's on the exam, understanding how to approach both exams, understanding how to apply the knowledge that I have, because we got the knowledge. You just need to know how to apply it. If there's areas that you lack in, then you need to fix those. And when it comes to practice questions, look, this is why I do daily practice questions with y'all, so y'all can hear me break it down. I know y'all, some of the stuff you probably can recite that I'm going to say, but I say it over and over, so hopefully it'll become second nature to you guys. But also, a lot of people I find struggle because y'all think you're supposed to do a million practice questions, and then you're not reviewing the rationales to be able to effectively retain what you're getting wrong, right? So you're doing so many, now you're tired, you're overwhelmed. You need to increase your muscle memory. Anything else, you got to build that stamina to be able to get through that. So I don't care if it's 10. If it's effective, you're working for the effective retention, the effective study, and not just to complete a task. So I know I said a lot, but don't give up. Know that you're able to do it. Trust where it is. Look and see where your weaknesses are. You know your weaknesses too. Go back at it. Make sure you're studying in that format that I'm telling you. And just strategize. Make yourself a study schedule. Do a certain amount of questions and build. Do all the things, y'all. Do all the things. Look, it is December of 2024, and many of you have spoken to me in January. And you talked about what you're going to do. You'll start, you'll fall off. You'll start, you'll fall off. Or something will make you discouraged or whatever else. And again, you're human. Give yourself grace. But it's time to say, all right, I'm going to pick my heart. No excuses. This is a goal that I'm trying to get done. It's only temporary. I'm going to push through. I'm going to do the appropriate steps, because we're all busy. So in these busy schedules, you need to make sure that you are using your time and maximizing that time with effective studying, and not spinning wheels and looking at so many different tools that you don't even know where to start. Now you're thumbing through and saying, well, I looked at hypertension on this one. Now I looked at hypertension on this one. This one says this. No, look at the blueprint on the test. It'll tell you if you don't trust what we're saying. so that you can confirm for yourself which one they're following through. That's why I'm able to tell you it's not that I'm just pulling it up. Look, I took boards almost 10 years ago now. And the reason I can tell you is because I research and I study what they put out. I tell you the blueprint. You see my video where I give you the blueprint. I'm telling you this stuff because I put in the work so that you can have what you need to know. But I'm telling you the tools so you can do it for yourself. I'm not saying, hey, come and work with me so you can do it. I'm saying, hey, girl, hey, man, you can do this if you just go ahead and follow these steps. Google and type in FNP exam blueprint, ANCC, AAMP, and tell me it doesn't pop up and tell you what the blueprint is. Again, I have a video on it. Then once you do that, look at what it's telling you. Now gear your mind on how you need to prepare for that. If you're struggling to identify which hypertension guidelines they're following, even though I'm telling y'all it's ACC and AHA guidelines, and I know what we do in practice. Again, cardiology is my background. When your blood pressure can't be maintained, they're going to send you to us, and we're going to do all the things to maintain it. I know we do different steps and different tactics. And as you know, on my spiel at the beginning of all my videos, I tell y'all, we treat on a patient-by-patient basis. I know. But on that exam, and if you ever hear me, I say for boards purposes, this is the reason why I say this, y'all. Because on exam, it's a perfect world. Everything is lilies and roses, and it is straight textbook. And I know that you might have wanted to use an ACE inhibitor, or you might do this, but guess what? Guidelines say we our starting four are our thiazides, our ACEs, our ARBs, our calcium channel blockers. But the thiazide, like I tell y'all, is the captain on the team, right? So we start with that unless there's a reason to rule it out. If they don't have diabetes or a reason that we need to give them renal protection, then on this exam, the ACE is not the beginning. Thiazides are. Trust me, okay? And so just steps like that. Knowing what they're testing you on currently, reviewing assessment, diagnosis, evaluation, and treatment, doing practice questions and reviewing those rationales, and go and be successful on boards. Okay? All right, you guys. You didn't come this far to only come this far. Get back to it. Do what you need to do. If you need to take a break and then get back to it, do whatever works best for you. But don't stop here. Delayed does not mean denied. All right. I hope you found this helpful. And back to my daily practice question. Bye, y'all.